welcome to my podcast. Today I'm going to talk about another theme which can be asked to medical student or to student who want to be a medical doctor in the future. So one of the theme it was about exploring the AE in the field of medicine. So the question was like, do you think AE, which is artificial intelligence, could replace doctor in the future? And what is your thought about this? And can you give your justification in that regard? Say, for instance, there were a lot of students who seemed to be very knowledgeable, very intelligent when they were applying this sort of question. Because nowadays, obviously, the artificial intelligence is taking a wide expand in different areas of our life. This could be in the future, in a few years' time, could be more evolved, more sophisticated. So they, some of the candidate or the student were really good in answering this, and I will try to jot them down and brief you about one of the main points. Say, for instance, from the positive aspect or from the pros, it could be a speedily tool to help doctors or to analyze, for instance, certain data, to provide certain pickup of any, say for instance, if there is any changes or a mass or anything that could be analyzed and picked up immediately by the system. And it could also help in the managerial position, like for instance, medical record managing, administrative work, appointing appointment for appointing and for a booking or change appointment. Also for the lab, when it's vast, quite big, it can analyze and pick up any abnormality, for instance, or in the histopathology as well. It can be wearable in certain conditions whereby it can monitor for any abnormalities, for instance, in the ECG or anything in regard. Also can help as a robotic in certain surgical procedures, like we know in the heart or nowadays in the hip replacement, and can interpret certain investigative tool, like for instance ECG, X-ray, and it has a little probability for error if the data were entered correctly and the proper training has been provided, because if it's not provided, it can cost a lot. And also it can help in, as I say, illness detection, early diagnosis, also can help in certain medication like drug recreation and development. It can reduce the staff pressure and can replace in certain places or certain remote area if there is, for instance, shortage of the staff, and it can provide certain care, presumably better patient care, and this will reduce the cost of care, and it can be in real time and accurate with accuracy, and as I say, with better administrative task, and can help with the digital consultation as well. However, from the consting, some they stated that it can't replace doctor. However, some they said it can replace doctors. Some they stated, like, for instance, if you're gonna establish the rapport with a patient, it can't replace that, because patient needs to feel that they are speaking to a genuine person, a human being who can express sympathy and empathy and could be emotional as well, because they don't want to talk to a tool who could be emotionless. And this, of course, it will create human laziness, and people will be procrastinating. and it won't be in certain area, won't be accepted because the public would like to have someone who's a human to talk to, because robot can't provide emotion or compassion or this sort of communication. However, it can be liable to some inaccuracy if an error had happened, and also it can't examine the patient as a doctor can do. It won't help with the mental health assessment or if there is any requirement for that. And the human factor or the element of a human factor is another factor to be considered. The machine or this one, the artificial intelligence, can be very expensive, can be very costly, and also the area of the ethic. It's not quite sure how this can be provided. And also the robustness of the AE and how the outcome can be assessed as a successful thing, and also can help, for instance, for a prescribing of, or if there is a repeat one. And it needs, of course, a skill required by human to provide the data and input it. However, it can be sometimes difficult to manage, and it can create the risk of unemployment and can be exposed to cyber attack, so security risk or breaching can happen. It can be very complicated as well, and it will always need, for instance, training. So it's reliable in certain situations, can be difficult in another. It can augment the work along doctors and can't replace, of course, doctors or the human connection. Can't replace the empathy and the emotion that anyone feels that they need to. It can help only in interpreting of the data, of their scan, and link to pattern and analyze it. This is something can be happening. It could reduce the AE waiting time, and say for instance, if there is any need for a checkup. So this is something probably can cover it. And it can provide certain functionality, as I said, but it can't cover all of that. It also can be completing certain tasks, like for instance, online consultation. If it's like when you go through any website and you fill the form and send it, you will get an automated message. So this could be another thing to help with. And then the other side, they're gonna read, and then accordingly they will act. So this is, could be a positive thing because it will help for a better outcome and faster responses with diagnosis, picking up and detecting anything that maybe a human being can miss it. It's less prone to risk or error once data has been entered correctly. However, the public might be a little bit wary if they are talking to a robot, as I say. It can't provide that doctor-patient relationship because it will be like a fake thing. So that's another thing really to consider. However, it's really a speedy thing if it's gonna be considered in the future, because it can replace a lot of thingy and save time. Comparing when you say that you have a lot of data, you need to enter it, and the AE can just make the task swiftly and in very short few just seconds. So that's an advantage. As I say, it can catch things early, and this, of course, will help a lot. However, as I say, patient might not trust it because patient, they feel that they need someone real to listen to them and listen to their problems rather than interacting with a robot. And they don't know if that's something that could be helpful for them. So this is something that can be considered as well. And other element can be considered is the element of the care. Someone said it's not fully replacing. It can be just like side to side to the doctor. And it's basically, of course, needs always the software to improve and update for better diagnosis and better conditioning, and can be biased sometimes as well, so it can miss out certain diagnosis. And of course, because it's a human entry anyway. Also, for cancer cases, it can help with the prescribing of the dose, so it can calculate and prescribe it accordingly because you're going to put, you will enter the data and it will calculate it accordingly to the case and to the condition. However, as I say, some they might be skeptical and couldn't believe it fully. So that's area to be explored. Ethically, of course, it's another issue. Need to be considered and explored more in order to know how this can be covered. But it's a promising area in the future, and it could help and save a lot, and can be also can be hectic if it needs a lot of testing in order to see if it's working efficiently and effectively. So that's another thing to be considered as well. And as I say, the element of confidentiality and the communication, the understanding, the ethic, it's a gray area. You wouldn't really know. And so that's basically all about the artificial intelligence and how those kind of teams can be answered or explored with the pros and cons around that area. So I hope by that I covered the main points about the artificial intelligence and how it can be applicable in the healthcare setting with pros and cons. Thank you.